Good morning, everybody. Pia, thanks a lot for kind introduction. And thanks a lot to all of you for joining us today in today's webinar. The focus of today's webinar is how one can achieve higher standardization and reproducibility in flow cytometric analysis with the use of recombinant reagents, especially in context of cell manufacturing. So this is the third and the last webinar within a three-part webinar series with a focus on standardizing flow cytometry assays in cell manufacturing. Today's focus is on reagents. If you're interested in learning more about how software solutions and instrument solutions can help you standardize flow analysis during cell manufacturing, then please have a look at the recorded webinars that took place earlier this year on our website. So we'll have a brief look at the cell manufacturing process as such and various in-process control and quality control assays that are used to monitor the quality of the cell product. This will be followed by an in-depth look at how one can achieve higher standardization within the flow cytometry assay, which is an important in-process control assay during cell manufacturing, with the help of recombinant reagents. The focus will be distributed among use of recombinant antibodies for monitoring different cellular parameters and monitoring the expression of the CAR on the CAR T cells, for example. So as you all know, cell manufacturing is a highly complex process. This complex process can be divided into various sub-processes and sub-steps, as indicated here for the manufacturing of CAR T cells. Just very briefly, one starts with starting sample derived from a donor or a patient. The T cells in questions are then selected, activated, followed by transduction so that one can induce the expression of, for example, CAR molecules. The CAR expressing T cells then are expanded to reach a critical mass, followed by a final formulation, which is the final therapeutic drug, and then administered to the patient. So each of these steps and sub-steps include a lot of activities through which the cell products go through. For example, during the sample preparation step, one has to do the cell washing, isolation of the leukocyte population, and followed by analysis to check the quality of the starting sample. Due to so many steps which can be spread over a lot of number of the days, it's very important to monitor and check the quality of the cell product at each and every step. And this is exactly done by different in-process control and the quality control steps, which are introduced at every sub-process. Here is a brief look on all different kind of in-process control and the quality control steps, which I will be calling as IPC and QC steps here on. So there are different type of assays used. For example, multiparametric analysis, where flow cytometric analysis is one of the most prominent assay. Within flow cytometry, one can study the cellular composition of the sample, the viability of the cells, can quantify the number of the cells within the sample. We can analyze the transduction frequency, that means the level of the expression and the number of the cells expressing, for example, CAR molecules. Determine what kind of impurities are present in the for example, the final cell formulation and what kind of cells there are present. There are several molecular biological methods used, for example, for quantification of the vector copy number and so on. Various analytical and microbiological methods are used, for example, during testing the safety of the final product, which includes microbiological control, assessing the level of the endotoxin, and checking the presence of the mycoplasma. So multiparameter analysis, such as flow cytometry analysis, can be a very powerful tool for checking the quality of the cell and cellular product. So flow cytometric analysis can help us assess a lot of different parameters in a very short period of time from a very limited sample. The technique itself can be highly automated, can be scaled up. And during the flow cytometry analysis, there are three integral components, that is reagent, instrumentation, and analysis software. And it is very relevant that all three integral parts of this technique work together and are highly consistent and reproducible in their performance, so that one can perform the quality check of the cell product with a high reliability. So let's look at what is routinely characterized using flow cytometry as an in-process control, quality control step. So what is commonly tested is the immune cell composition, and this is done at various steps. And once the cells have been transduced to express the CAR molecule, then what is the routinely tested is the transduction efficiency, where the number of the T cells expressing the CAR molecule and the level of the expression of the CAR molecule is often routinely tested with flow cytometry. Now here are further parameters that are analyzed, which, for example, we analyzed during the preclinical phase or the preclinical research phase to follow the differentiation phase, activated, exhaustion phase, and to monitor the proliferation capability of the T cells. And this is basically done in flow cytometry by the help of various different parameters and the markers, and indirectly with the help of use of different fluorochrome conjugated antibodies. Before we move on details of the different flow cytometric analysis, let's just have a quick look at what are the different sources of variability in the flow cytometry. So there are 5 possible sources of variability in flow analysis. One key source is variability arising from the starting sample, that is donor to donor variability. Inconsistent performance of reagents. Changes in performance over a period of time or from device to device in case of a multi-device setup for cell manufacturing. So that means that's coming from the instrumentation. Variability due to the way and who analyzed the data. So for example, if analysis is not an automated step, then the analysis can vary depending upon who has done the analysis and how the gating was set. And of course, one of the great sources of variability can be how the documentation is done, and if the documentation is sufficient enough to reproduce the analysis in a way that was done previously. So out of all the sources that is very difficult to manage or cannot be controlled is the one that arises from the donor to donor variability. However, it is quite possible to control the performance of reagent, instrumentation, and software solutions so that they give highly consistent results. And this is exactly a good starting point for the second half of this webinar. So there has been several debates and discussions that happened during various antibody validation meetings that took place in the past few years on how one can improve antibodies-related reproducibility. So these are very obvious suggestions. However, it's worth it's worth to have a deep look at them once again. So one very important point is application-specific validation of antibody. That means if you're using an antibody for flow cytometry, it should be validated for specificity, sensitivity, and consistency in performance within the flow cytometry context. Transparent and clear reporting of reagent usage, that is, for example, the titer, the protocol, the concentration, or any kind of variability that or differences that might happen as compared to the vendor when a user is establishing its own protocol. The final and the most important aspect, which will be the focus of the rest of the webinar now, is use of consistent quality antibodies. And this brings to the point that it doesn't matter how much efforts can be spent in establishing a consistent protocol or usage, unless the starting clone and the antibody itself is of highest quality and consistent in performance, there will always be a probability that you will introduce variability within your analysis. The reason of proposing different steps, how to achieve antibody-related reproducibility, is because of a lot of different publications and the debates that have been initiated in the scientific world. So they started from 2015 and have been ongoing, where there has been a lot of publications coming. And the main message of these papers are that the classical and the conventional antibodies that are routinely used for flow cytometric analysis, for example, the hybridoma-derived monoclonal antibodies, they are not monospecific in nature. They're highly impure in their consistency. And that's why eventually they can change their performance over a period of time. That means, for example, from lot to lot. And it may be eventually that a clone is not anymore available because of just the nature of how the antibodies are produced. And the answer to these issues are basically use of recombinant reagents. So this was the starting point for us as well, and for establishing all kind of flow cytometric analysis for CAR T cell manufacturing within Miltenyi Biotec, we have developed the recombinant antibodies for the cell analysis purpose. So these are the REAfinity range of recombinant antibodies. They are recombinantly generated in an in vitro expression system, and I'll explain you later on how the recombinant generation ensure very high reproducibility in the product performance. They all has been engineered and designed in a way that there is a mutation in the Fc part. That means they do not bind unspecifically to any of the known Fc gamma receptors. And they all carry the same isotype. Therefore, any kind of isotype dependent variations that might happen during the analysis are eliminated. So just a brief look at the differences or how the recombinant antibodies are manufactured and what is exactly the reason of them being so reproducible. So here you see a workflow of how the classical conventional monoclonal antibodies are generated. They are derived from so-called hybridoma cell lines. And the whole purpose of this technique was to generate highly monospecific homogeneous mixture of antibody that recognize a single epitope. However, as it has been published and proven again and again, that antibodies generated by hybridoma technology are not monospecific because they are highly contaminated with different kind of immunoglobulin derived from different sources. For example, from the myeloma cells that is used to generate the hybridoma cell line. For example, the serum that may be used for cultivation, leading to a heterogeneous mixture of antibody. So for example, if you aim to generate CD3 molecule, a conventional hybridoma antibody might not be 100% CD3 within the formulation. On the other hand, a recombinant antibody is generated from a very defined sequence. So a CD3 antibody starts from a sequence that is only encoding CD3 molecule. They are produced in a highly standardized expression system and culture condition. And the expression system only produces the antibody that is it is programmed to produce, and no other immunoglobulin contaminating chains. This leads to a very homogeneous mixture of antibody. So higher the purity of the starting antibody, the higher the chances are that you get final conjugated product of very high consistency and pure performance. So this is just an example to depict how pure the recombinant antibodies can be. So here on the left-hand side, you see two independently and randomly picked hybridoma antibodies. They were subjected to mass spectrometry analysis to see the protein sequence. On the x-axis, you see the molecular weight of the light chain. And as you can see, that the desired productive chain, light chain, is present in this protein in the final analysis. However, there is also a contaminating light chain, and this has nothing to do with the final antibody molecule. On the other hand, the recombinant antibodies, when subjected to the same analysis, show the presence of only the productive light chain, that is the light chain that should be a part of the antibody. So when you start with a very highly pure product and conjugate to a quality controlled pure fluorochrome, followed by thorough removal of the unconjugated pure antibody and unconjugated fluorochrome, then one can end up with a highly pure final product, that is the desired product which is needed for flow cytometric analysis. When these pure product is subjected to right quality control tests, for example, consistent lot-to-lot testing, then it's quite, then the chances that you start with a clone which is inherently consistent in its performance is pretty high. Here's just an example of how this translates in the flow cytometric analysis. So on the left-hand side is the in-house Miltenyi Biotec generated data, where CD56 REAfinity clone REA196 conjugated to 3 different fluorochrome. 2 different independent lots were compared, and as you can see, they were quite consistent in their performance. On the right-hand side is a data provided by one of our customers, and here 3 independent lots of CD56 conjugated to PE fluorochrome was tested, leading to, and the data shows high consistent performance. One interesting aspect of these antibodies, and why it was even more interesting for us to include these antibodies for different IPC QC flow cytometric steps during cell manufacturing, was the possibility to engineer these antibodies in a way so that can enhance the flow cytometric analysis and eventually lead to higher consistency. So all of these antibodies, independent of what the specificity is, carry a mutation in their Fc part. Because of this, they do not give any background signal. So in the absence of a background signal, the true positive signal is more reliable, and that means you can easily automate your analysis and can rely on software solutions that automatically identify the positive population without being concerned of detecting a false positive population. This slide shows here the proof of how this mutation can greatly enhance the analysis. So during the process of clone selection for designing the final flow cytometric antibody panels, one step is assessing the performance of the different clones. So here we established the recombinant antibody technology, and we were comparing the performance of the recombinant REAfinity antibody CD8 conjugated to bio-green fluorochrome to different available hybridoma clones in the market. And the data was performed at the customer site. So here you see that 2 different randomly picked hybridoma clone gave 2 different kind of final results. So, and another point was that, for example, in the hybridoma clone 2, this is the positive signal, which is present in both of the, when both the clones were used for analysis. However, in the clone number 2, we see an unspecific false positive signal here, which can be identified back to a background signal. However, not only when the REAfinity clone, the recombinant antibody clone, is used, that you get a good separation of the positive and the negative signal, the unspecific background signal is completely absent. So that means you do not have to rely on screening the different number of the clones to get the best signal, but also with the use of the recombinant antibody, one can be sure that not only the positive signal is reliably present, but also there is absence of the background signal. This was again evident when we were trying to screen and to ensure ourselves that the recombinant CD3 clone is the right clone to be included in the antibody panels during IPC-QC flow cytometric analysis. So here the hybridoma clone recognizing CD3 conjugated to FITs was compared to the recombinantly generated clone REA613, again recognizing CD3. So here you see the left-hand side analysis done with a hybridoma clone. During the analysis, one can clearly identify the CD3 high population. This is the signal of interest. However, there is a CD3 dim population was also evident, and when you try to identify the source of this population, whether they are true, whether the signal is indeed coming from CD3 positive cells or not, then we identify that this was happening due to unspecific binding of the CD3 antibody to the granulocytes. This, however, was not the case when clone REA613 was used for labeling cells and eventually for analysis. Here one can only see the true positive population, but the background signal is absent at all. So just to summarize, the first point always is for a consistent flow cytometric analysis, the right selection of the clones, and to make sure that the starting material is consistent in its performance and will stay consistent. And this is why we introduced the recombinant antibody technology for flow cytometric analysis, which are recombinantly manufactured antibodies. And the manufacturing technique itself ensures high lot consistency and reproducibility. During the recombinant expression process, we introduce mutation in the Fc region of these antibodies. This allows us to get background-free signal, and hence one can focus on a true positive signal, which allows the automated analysis and eventually high consistency in the analysis. All of these reagents are validated for flow cytometry with 3 key parameters in mind. That means sensitivity, specificity, and reproducibility. Now, once the right clones have been selected and they are routinely used for IPC-QC of the cell product, they go through further extended validation, which includes testing the parameters such as accuracy of the analysis, precision, linearity, how robust the analysis over a period of time, how sensitive it is. That's why the limit of detection is thoroughly checked and routinely checked. So this slide shows one of the examples of how the specificity testing is done, and this is one of the type of the specificity testing that is done during the validation process. So here the aim is to understand if the positive signal that may arise due to binding of the recombinant antibody is only because of binding of antibody to its epitope and not because of unspecific binding of the fluorochromes. In order to check this part of the specificity, so the cells are first labeled with antibody of interest. For example, here CD45RA, clone REA1047 conjugated to over fluorochrome via blue. And this is the positive signal. To do the specificity testing, cells are first blocked with excess of the purified antibody. And in the absence of a positive signal, one can come to the conclusion that the binding signal is solely coming from binding of an antibody to its epitope and not because of unspecific binding of the fluorochrome. So once the clones have been selected, once the parameters have been defined, as I explained you before, we can define different antibody panels for analyzing the different states of the T cells along the process of the CAR T cell manufacturing. And here in this slide, you see an overview of different antibody combinations that are used to analyze different T cell parameters. So besides the critical evaluation of what marker and what clones to be included in the panels, there were some additional considerations that were included in design of the panels. For example, there were multiple 8 color panels were defined in order to have higher flexibility and less issues that can come with high parameter panels, for example, due to compensation. Then some of the channels were always set for identifying certain markers. For example, CD4, 3, and 8 were always detected in the same fluorescent channels, independent of which panels was which antibody panel was used. And then identification of the expression of the CAR that is done, for example, using CAR T cell differentiation and persistent panel. That was done using CAR detection reagent, and it was ensured that this detection is always taking place in one of the brightest channels, such as PE. So this is just a zoomed in version of one of the IPC-QC panel, for example, the immune composition panel. The aim of this panel is to determine the cell viability and the composition of the different type of the immune cells that are present at different stage during the CAR T-cell manufacturing. And this is just an overview how different recombinantly engineered antibody clones are used to define the final panels. So just to indicate how one can identify that we are working with a recombinant antibody is that the REAfinity clones are indicated as REA clones followed by numbers. So our immune composition antibodies and antibodies for identification of the transduction efficiency of the CAR T cells are also available in the CIVD quality grade, which and these antibodies are designed and manufactured according to quality management system of ISO 13485. And this manufacturing and quality management system fulfill essential regulatory requirements for in vitro diagnostic medical devices. The last few minutes of this webinar will be focusing on reliable detection of the expression of the CAR molecules on the CAR T cells, and what kind of considerations have to be included in using the right detection reagent. So the consideration on choice of best reagent for identifying the CAR molecules, for example, are quite similar to those what one has to think about when picking the right clones and the antibodies for analyzing other parameters on for example, T cells. However, it becomes even more critical when one wants to reliably analyze the expression of the CAR molecule. It's because the CAR expressing T cells, they represent the therapeutic cell fraction, and that's why it's become even more critical that the quantification and the level of the expression of the CAR molecule is done in a highly reliable manner. And this is also done at different stages of the cell manufacturing process. And as the cell changes from one stage to another, it becomes even more inherent that the detection reagent used for expression of the CAR molecule is highly consistent in performance and can take into account the changes that might happen at the cellular level. So to tackle that question, we developed the CAR detection reagent that is the CD19 CAR detection reagent. And the CD19 CAR detection reagent follows the basic principle and similar properties to our recombinant antibodies that I have introduced you before. However, briefly, just to explain you, so if this here represents the CAR molecule that is expressed on, for example, CAR T cell, then the CAR detection reagent, that CD19 CAR detection reagent, has been developed in such a manner that can not only recognize the CAR molecules that developed by us, but also it can be used for detection on all kind of CAR molecules independent of the design, CD19 CAR molecules independent of the design. So the CD19 CAR detection reagent is a biotinylated CD19 extracellular domain antigen, which is fused with a mutated human IgG1 region. And this is how it is represented here. So here, this is in the black spiral, represent the CD19 extracellular domain. And this part represents the human IgG1 mutated part. Now this fusion protein is then conjugated to the biotin molecule, and for detection we use a two-step strategy, that is antibiotin PE used. As I explained you before, similar to REAfinity antibodies, the mutated human IgG1 Fc part of the CAR detection reagent ensures that this detection reagent do not bind unspecifically to Fc gamma receptors that might be present or overexpressed on the, for example, activated T cells or any other cell fraction in the sample. Since the CAR detection reagent carries the extracellular domain of the CD19, it more or less ensures or kind of mimic the binding of CD19 antigen to the CAR T cells. Now, due to recombinant expression of this whole construct, one can ensure high lot-to-lot consistency in its performance. Because the detection is based on CD19 molecule, this detection is highly specific in nature, as opposed to when you use detection reagents such as protein L. The conjugation strategy has been in a way to ensure highly sensitive detection of the CAR molecules. That means even in case of a low number of the T cells expressing CAR or the low level of CAR expression, one can reliably detect the expression of the CAR molecule on the T cells. And as I mentioned before, this interaction mimics the CAR molecule binding to the target cells. And therefore, it's an indirect indication that the CAR T cells or the CAR molecule on the T cells might also interact with its target cells. So here is a comparison overview of the CD19 CAR detection reagent developed by us as compared to the CAR detection reagent provided by different providers in the market. So as you can see, the detection of the CAR T cells using CD19 CAR detection reagent followed by antibiotic PE detection, one can get a good separation of the positive CAR T cells population and the negative population of the T cells which are not expressing a CAR molecule. And this is quite evident as compared to the comparison done to the CAR detection reagent from other providers which follow the same two-step detection strategy. Here, as compared to the CAR detection reagent, which is directly conjugated from provider 3, there is hardly any positive signal notable. Another interesting point of CAR detection reagent provided by Miltenyi Biotec is that it is available in ready-to-use pre-titrated form. However, this might not be the case with the other commonly available CAR detection reagents, which might be available in lyophilized form. And then preparing the right formulation and then establishing the right titer can lead to another validation step. So this brings us to the summary of how the recombinant technology can be highly useful in achieving higher standardization and reproducibility when flow cytometric analysis and antibody panels are established. So it's inherent in the nature of the production that recombinant antibody technology ensure high lot-to-lot consistency and hence the reproducible analysis. The REAfinity technology of recombinant antibodies also ensure no background signal. That's why reliable positive signal. And this is very important, and what we also saw in our own analysis, that this is a critical step if you want to automate the analysis. These reagents have been validated in the context of cell manufacturing, and a lot of different criteria are thoroughly tested. So before we reach an end, I'd like to take the last remaining minutes to summarize the key messages from the other webinars that took place earlier this year, and there the focus for also improving standardization. So improving standardization by using high device-to-device harmonization can be established using the SmartGain technology on the MaxQuant instruments. The basic principle is that one can optimize the instrument settings on instrument A, can transfer the same settings to instrument B, That means in case of a multi-device cell manufacturing establishment, one can achieve high device-to-device harmonization that can lead to consistent performance independent of who the user is, and independent of when the test was done. Similarly, we introduced a software solution to automate the analysis aspect of the flow cytometric analysis. And this is again highly relevant in order to achieve a consistency during the flow cytometric assays. So basically, with the help of the express mode solutions available as a part of the Mix Quantify software, one can identify the positive population and automate the whole analysis aspect by just the push of one button. So these three aspects of using recombinant reagents, using high consistent device-to-device performance, and automated analysis eventually can lead to higher standardization assays during when flow cytometry is used as during the in-process control and quality control step. So this brings us to the end of the webinars, and thanks a lot for your attention.